Jane. I'm Julia Smith. I'm a nurse practitioner student. Tell me what brings you here today and what's going on.
Okay, I've been having some pain in my upper right side.
How long has that been going on for?
The last 3 weeks have been more significant. Otherwise, it's been going on maybe a year.
Okay. Have you had this before?
Off and on the last year.
Off and on for the last year. Okay.
Right.
And do you think the problem is getting worse or better?
I think it's getting worse.
Okay. Is there anything that you do that makes it better or worse? Like, are you at rest or doing an activity?
It's usually when I'm at rest and I go to get up from sitting in the chair.
Okay.
And then it starts to, almost like a lightning bolt sensation, you know, it's real sharp.
Okay, sharp pain.
Yeah.
And then, so would you say that it kind of radiates then?
Yes.
Okay. And where does it radiate to?
It goes up underneath my ribs.
On which side?
On the right side.
On the right side, okay.
Right.
And if you were to rate that pain on a scale from 1 to 10, with 1 being like real minimal pain, 10 being the worst pain, what would you rate it at?
I'd say around 8.
Okay. And then is there any time of day that the pain is more significant?
It's usually always the same time every day between 12 and 1 o'clock after I've had lunch and I go to sit down in the chair and watch a little TV.
So after lunch,
Yeah.
basically.
Yeah.
Any other associated symptoms with that? Do you have any like nausea, vomiting, or?
Some nausea with that
Okay.
and discomfort. It seems like my blood pressure might be dropping during that time because I get real tired.
Okay. Have you taken your blood pressure during that time?
No, I haven't.
What about your pulse?
No.
Okay. Do you have a blood pressure cuff?
No, I don't.
Okay. Like a lot of your pharmacies, you could actually get a blood pressure cuff, and I know like at Walgreens they'll even help you fit the right size cuff.
Okay.
All right. Jane, how old are you?
65.
65. Any significant past medical history?
I've had problems with GERD.
Okay.
And I have diabetes.
Okay. Is it
And
type 1 or type 2?
Type 2.
And are you on insulin?
No.
Okay. Any other significant?
I have hypertension.
Hypertension.
Yeah.
Okay.
I've had a past heart attack.
Okay. Do you know how old were you when you had the heart attack?
About 50.
50 years old?
Mhm.
Okay. Any other health history?
No.
Okay, what about thyroid disease? No thyroid
No.
disease? No cancers or anything?
No.
Okay. What about high cholesterol?
Yes.
Okay. And did you bring your labs today?
Yes, I did.
So that's got your cholesterol rate on there. Looks like your total cholesterol is 173 or 175, and that looks good. Triglycerides are at 163. They're a little elevated. Your HDL is at 52, which is good, between that 40 and 60, and that's where we want that one to be.
Okay.
Your LDL is at 106, which is just slightly high.
Okay.
So, and you are on cholesterol medication, correct?
Yes.
Okay. And then, have you had any surgeries?
Yes, I have. I've had in 92, I had gallbladder surgery. I had that removed.
Okay, so 1992.
And in 94, I had colon surgery and vocal cord surgery. I had polyps on both of those.
Okay.
And those were diagnosed as non-cancerous. And then I had my heart attack in 1998. And also one of my births of my children. I had my daughter, they had to do a forceps delivery.
Okay.
But that went okay.
Okay.
And my son was an emergency C-section.
Oh, okay. And what years were they born?
Okay, my daughter was born in 1969,
Okay.
and my son was born in 1976.
All right. Any other hospitalizations besides that?
Yes, I also had knee surgery.
Okay.
That was about 10 years ago.
Okay, so roughly about 2004.
Yes,
Okay. And then, did you bring your medication list today?
I sure did.
Awesome. So we're just going to go through that real quick.
Okay.
So you're on the lovastatin, that's for your cholesterol, and it's 20 milligrams one time daily,
Right.
and you take that in the evening,
Yes.
and you're on vitamin D, You're on 50,000 international units, and that's twice weekly. And that was just lowered because you had your vitamin D levels were at 83, so they backed off. 8 carbos, 25 milligrams 3 times daily, and you take that with meals.
Yes.
And hydrochlorothiazide, 25 milligrams 1 time daily, and you take that in the morning.
Yes.
Metformin, 500 milligrams twice daily, and you probably take that with meals too.
Yes, I do.
Okay. Lisinopril, 10 milligrams 1 time a day, and you take that in the morning.
Yes.
And your Chlorcon, 10 MEQs, extended release 1 time daily in the morning.
Yep.
Your omeprazole, 20 milligrams twice daily. Do you take those? You take those one like with breakfast and one at supper?
Right.
Okay. And the atenolol, 25 milligrams. You take a half a tablet 1 time daily in the evening.
In the evening, yes.
Okay. And then your multivitamin, you take that once daily. And a low dose aspirin, 81 milligrams, and you take the enteric coated. You take that once daily.
Yep.
And you take vitamin B12.
Right.
You don't happen to have the milligrams for that, do you?
No, I don't.
Okay, that's okay. And I'm going to give you both of these back because these are your copies.
Okay.
Any other over-the-counter medications or anything that you use?
No.
Okay. We're going to kind of revisit like some allergies. I have some questions about allergies. Do you have any medication allergies?
Yes, I do. I've had reactions to penicillin
Okay.
and cortisone
Okay.
and the sulfa medications.
What happens when you take penicillin?
I break out in the hives and my throat closes off.
So you have some anaphylaxis with
Yes.
that, huh? Do you have an EpiPen?
Yes, I do.
Good, good. What about the sulfa?
Same reaction.
Okay, so you have anaphylaxis with that too.
Yes.
And then what about the cortisone?
The cortisone, I've been able to take injections, but when I take it orally, then that's when I have the complications of breaking out in the hives again and throat closing
Throat
off.
closing?
Yeah.
Okay. Do you have any allergies to latex?
Not that I'm aware
What about any different foods?
of. No.
And then do you have any seasonal allergies?
Yes, when the seasons change, it seems like the molds that are in the air and stuff, I have a reaction to that.
Okay. Any allergies to any pets or animals?
Not that I'm aware of. We have a lot of pets, so.
Okay, gotcha, gotcha. Jane, how many times have you been pregnant?
3 times. I have the boy and girl, but the one child in between I miscarried.
Okay. And then do you still have your menstrual cycles?
No.
Okay. And then how long ago did those stop?
It was about 50, so 15 years ago.
Oh, 15 years ago?
Yeah.
When it stopped, did you have a lot of hot flashes, or did you have the...
I did, yes.
And then as that subsided, you
Yeah,
don't have
there's
it?
none.
Okay. When did you have your last colonoscopy?
A couple years ago.
Okay, so 2012, would
Yeah,
you say? Okay.
somewhere in there.
Okay. What about a bone density?
It's been a few years, about 15 years.
Well, 15
so,
years, so you're probably coming due to have another one?
Yep.
Okay. I'm going to touch on some family history too. Your parents, are they alive?
No.
Your father, how old was he when he passed away?
He was 62.
62? What did he pass away from?
From cancer, basically. Took him, he had lung cancer.
Lung cancer?
And he was a heavy smoker.
So did he have emphysema, or they call it emphysema,
Yes.
COPD they call it now?
Yeah.
And then any other history with him?
Yes, he had a heart attack and he also had type 2 diabetes.
How old was he when he was diagnosed with diabetes?
I think he was around 59.
Okay.
Yeah.
What about...
He never saw a doctor on a regular basis, so we don't have
Sure, sure.
too much history on
How
him.
old was he when he had the heart attack?
I'd say he was about 59.
Okay. What about your mother?
My mother passed away at 68. She had Blaze, what do they call it? Blaze?
Boulets?
Yes.
And what type of boulets were they?
It was lung.
Oh, the lung. Okay.
Yeah.
All right. Any other significant history with her?
She had a thyroid condition and they treated that with some radiation.
Okay.
And she also was bipolar.
Okay. And then, what was her cause of death?
Basically from the lung condition. She had repeated lung infections that were going on all the time.
Okay. Any siblings?
Yes, I have 5 siblings. My brother Gary had heart complications. He had to have 8 bypasses done,
Okay.
and he also has type 2 diabetes.
Oh, okay. How old was he when his heart disease started?
I'd say at around 50.
Oh, 50?
Yeah.
Okay. What about his diabetes? Do you remember how old he was and diagnosed? Kind of roughly.
He was probably in his mid-40s.
Mid-40s? Okay.
Yeah.
Any other siblings with any complications? Or...
Yeah, I have a younger sister, Sherry, and she has type 1 diabetes,
Okay.
and she uses the pump.
Okay. So she's...
hers.
Okay, so she uses an insulin pump then?
Yes.
Any other siblings with any significant history?
My older sister, Judy, has problems with TB.
Oh, tuberculosis.
Yes.
Okay. Have you ever been tested for
Yes,
TB?
I have.
And that was negative?
Right.
Okay. And then, what about your children?
Okay, my son Jesse, he has hypertension, and he also had Chiari's syndrome.
Chiari malformation?
Yes, and he had surgery for
Surgery.
that.
How old was he when he had that surgery?
I'd say about 32.
Okay.
And he also suffers with some depression.
Okay.
And my daughter Julia, she has type 2 diabetes,
Okay.
and she's got PCOS.
Oh, polycystic ovarian syndrome?
Right. And she suffers from hypertension and fibromyalgia
Fibromyalgia.
and
Okay.
some depression too.
Okay. All right. All right. So, with that, we're gonna move on to your social history. What do you work outside the home?
Not outside the home, but I do work in my. Oh yes, I do. I work at H&R Block. It's seasonal.
Okay.
So I'm there a couple months, and I do reception work there.
So, like maybe just during the tax time, then.
Yes.
Reception work. Okay.
Right.
And then any other work?
Yes. In my home, I do respite care,
Okay.
and I do that 4 days a month.
Okay. So something part time then besides
Right.
for the rest of the year then.
Right.
Okay. Are you married?
Yes.
Okay. And have you used any tobacco ever?
Yes.
Do you now or?
No, I haven't smoked in 15 years.
Oh, okay.
Mm-hmm.
How
And I
long-
smoked for about a 6-year period.
Oh, for about 6 years. Okay.
Right.
Any alcohol use?
I used to drink, but I don't drink anything now.
Okay. What about any illicit drug use? We have to ask that.
No. Not even in the 60s.
Not even in the 60s, huh? What about immunizations? Did you have your flu shot this year?
Yes, I did.
And what about the pneumovax?
I think I'm due for that this year.
Okay, so you've had one in your lifetime,
Yes.
and now you just turned 65 this year. Has there been
Right.
more than 5 years between? Like, if you were to get one today, would there be more than 5 years past?
I think so.
Okay, okay. We can double check your records with
Okay.
that too. Now, the other question I have is in relation to your code status. That is like if resuscitative measures, like if you do not want to be resuscitated or you do not want to be intubated, or what they call a full, you're a full code where they would do CPR.
Right.
Are you a full code?
I don't have anything in place, but I'm wanting to do that the next time I see my doctor.
Okay, so you want to do like a living
Right,
will. Okay,
right.
okay, gotcha. So no DNR, no DNI.
No.
Okay. All right, I thank you for that, and then we'll get on with the exam.
Okay, thank you.